bamwe isuku n'umuco rwose, ariko ku bandi uracara urugamba, kuko niyo mpamvu ko nakomeje kubibabwira, kuri bamwe niyo mpamvu ubona bakoresha amazi adashobotse, bagapfa gukoresha ya mazi yo mu birohwa akaba ariyo bakoresha mu ngo zabo. naho ubundi iyo ureba ku rundi ruhande usanga bamwe isuku bayimakaza bikagenda neza.
Camp, and it's a big challenge also to bring development of here, but we are trying our best to teach this community about the prevention of dengue. You can see people, the crowd, and how people are living here. It's very huge.
Thomas's story actually points to what is happening in our part of the world, and it actually brings two main things if you listen to his exciting story. One is what the Lord is really doing through ordinary leaders, ordinary people, through the training they receive, being good stewards of it, going into their own community, identifying along with community leaders and community members challenges that are within the community as far as the gospel is concerned and as far as neglected tropical diseases are concerned. And then they're mobilizing from within and working together to actually solve these problems.
cyane, abandi bana baramureba bakavuga ngo abayeho neza, ngabo ngo nabakire ngo ntacyo babaye, bikamwe kose ngo rakajya nawe akishima akagira ngo nta kibazo afite, ahubwo agoye inzoka zo mu nanje. Uko nguko niko nari meza, abana ariko nanje bari kunyita bari kuvuga ngo wacu ngo turabakira si ibintu nk'ibyo. Nuko rero noneho naje no gukina, kubera nakinaga ntabwo nabaga mfite ngakina, gutaha narushe kubera gukina ngasinzira ntanariye, ngahita njya no kuryamira ndakaraba. Inzoka zarangiyaga nijoro zikandi basanga mbese pezikanje najyanira naba ndutse nkabyuka nakerewe, abandi bana bagiye ku ishuri, inzira ije ku ishuri nayo ni ndende, mwarimu yaba ari kwigisha simbyumve kandi ndi ku ishuri nicaranye n'abandi banyeshuri simbyumve, kuko inzoka zo mu nda zarangiyaga ndi mu ishuri, nimba mvuye mu rugo ntanikirayi ndiye ngasinzirira mu ishuri. Nari nageraga mu rugo nimba ababyeyi banje bambajije ngo wiziki ngahita njya kujyamo bakareba mu makayi bagasanga mbese nta nubwo, bakagira ngo nandikaga kandi nandikaga nabwo nkandika ndi gusinzira noneho abandi bana bakaba bambere njyewe nk'abantu. Twari twaracukuye umwobo ukajaja amazi aturutse ku gasozi, imyanda zose iturutse ku gasozi zikiba mu mwobo nk'umuco bwite twari twaracukuye, amazi tukavoma noneho tukayatekesha tukayanywa yameze icu, twarayameseshaga tukayogesha ibintu, tukayogesha ibyo tugiye guteka. Amazi twanywa twaragendaga nimba amwe aturutse mu tiya yandi ari gutemba mu migenda, noneho akaba ariyo tuvoma. Ya myanda yose yagiye irava ahantu mbese ku butaka, bimwe mbese bigahita byihubura umwungu umwe mu migenda, tukagenda tukayavoma.
None kubera imyumvire abantu abantu bamwe barakituma ku gasozi. Ni ukubera kwituma kwa kariya gasozi, imvura iyo iguye ya myanda iramanuka, yamanuka ya mazi bibwira ngo ni meza yagera muri ya mazi hasi, mu mazi hasi agatera uburwayi, noneho bagapfa kuyanywa. Bamwe ngo ntibakwirirwa barateka amazi, ngo nta nkwi bifitiye, ngo nta makara bafite. Ibyo byose ugasanga ni ibintu biri kugenda bikurura imyanda hato na hato mu baturage hirya no hino. Abenshi mu bihe by'imvura binywera amazi aturutse ku mabati hejuru, kandi ariya mazi nayo bagapfa kuyanywa, ntibayatetse, ntibagize uti, bagapfa kwinywera. Hari n'abavoma mu gihe amazi yabuze, hari n'abavoma ku migezi imanutse. Kandi iriya migezi imanutse iturukamo amazi mabi ari kuva mu misozi hejuru. Noneho na biriya byoba cyane cyane no mu kibaya birimo, kuko mu kibaya bakunda guhura n'ikibazo cy'amazi. Ubwo rero iyo yagize amahirwe cyacuba kikazamo amazi, arayavomesha kandi akayatekesha kandi akanayiyuhagira, kubera ko yabuzaga n'amazi meza. Akayogesha n'ibirayi, akayogesha imboga. Ni uko batitegereza neza, hariya hasi urebyemo ubonamo utuyoka tuba turi kugenda twinyagamburamo hasi. Imbeho hari igihe bataha banyagiwe, kubera ko aravuga ngo mbe n'imvura ntiyamwuhije, ngo n'imvura ngo yanyagiye yakuremo imyenda yasanga aratose, ukwiyuhagira bikaba birarangiye rwose. Ariko ubuzaho ni byiza, ko niba hahozeho guhugurwa cyangwa se kwigishwa, byashoboka ko n'imyumvire yagenda ihinduka gato na gato. Noneho n'abari aho nabo batari bahindura imyumvire yabo, nabo bakagenda bayihindukaho, kugira ngo ibintu bishobore kugenda neza. Twimakaze, dukomeze kwimakaza isuku n'isukura mu baturage no mu ngo, n'imyifatire yabo, uko bakwita ku mawese yabo, uko bakwita ku matungo yabo, bakayubakira amazu ku ruhande kugira ngo bere kurarana nayo.
This is Kunjan Basti slum, situated in the southwest part of Delhi. We have a brother named Akash who is living here since last 25 years with his family. He has attended SMM training and had a heart to bring changes in this area and teach people about NTDs and cleanliness. People living in this area are migrated from different states. They work as rag pickers, domestic worker, and scrap automobile work. Akash continually train and organize awareness to small groups in the slum. This is Brother Akash's house. This is the place where he lives with his parents, his brother, sister, his wife, and his child.
मेरा नाम आकाश है मैं दिल्ली कैंट में रहता हूँ, मुझे 25 साल हो गए रहते हुए, और मैंने यहाँ पे बहुत ज़्यादा हालत ख़राब थी यहाँ पे एरिया में, स्लम एरिया में। और मैंने जब SMM से ट्रेनिंग ली तो यहाँ से बहुत लोगों को चेंजेस देखी, डेंगू के बारे में बहुत से लोगों को सिखाया। मैंने यहाँ पे अपने स्लम एरिया में बहुत ज़्यादा गंदगी देखी है, और मैं यहाँ पे अभी लोगों को डेंगू के बारे में सिखा रहा हूँ और उनको और कोशिश कर रहा हूँ कि बेहतर बनाएं। मेरा यहाँ के लोगों को स्लम को एरिया में सिखाते हुए थोड़े समझदार हो गए। मैं SMM को बहुत बहुत धन्यवाद कहना चाहता हूँ। वो हमें बहुत सारी जानकारी या ट्रेनिंग दी है, हमें बहुत सारे यहाँ पे डेंगू के बारे में और छोटे छोटे लोगों में स्लम के बारे में सब लोगों को यहाँ पे समझाया, और साफ़ सफाई हर चीज़ में हमारा ध्यान दे और हमारे साथ रहें। मैं SMM का बहुत बहुत धन्यवाद करना चाहता हूँ। धन्यवाद।
हेलो, मेरो नाम बिटु र म SMMमा मास्टर देवेनसँग जोडिएर काम गरेको केही साल भयो। अनि मैले यो SMMबाट सिक्दै गरेको कुरो एकदमै म धन्यवाद भन्न चाहन्छु SMMको डाइरेक्टरहरू जति पनि छ। अनि अहिले मैले सिकिसकेर अहिले एउटा ट्रेनिङ जस्तो लिएर अनि मैले अहिले अरूलाई सिकाउने मौका पाइरहेको छु अनि अरूलाई अवेरनेस गर्ने मौका पाइरहेको छु। अनि म एकदमै थ्याङ्क्सफुल छु तपाईँहरूप्रति अनि तपाईँहरूले गर्नुभएको अनि जोडिएर काम गर्दाखेरि म एकदमै खुसी छु। अनि एज अ भोलिन्टियरको थ्रु पनि मैले काम गरिरहेको छु।
First of all, I would like to thank God and SMM that since 2017, 19, for 3 years we have been working in this camp, slum area, where Brother Akash stayed, and we have been teaching people about zero training and how to prevent dengue based on zero method. So it was very easy to teach those people in the local language, and now people are very much aware about dengue. And before SMM entered in this village, as I asked so many people, there are several dengue cases. But after the SMM training, and when I met Brother Akash and through him I came here, and after started teaching about prevention of dengue in zero method, so people they understood and they very much aware, and after that people are very much careful about cleanliness and about mosquito spread. So people because of their understanding and getting the knowledge and getting the teaching from SMM, and now people are living good life, healthy life. And even now, if I ask people out here, there are no more dengue. There are still challenges because if you see the people out here in the slum area, they are illiterate people and their lack of education. So we have to communicate them again and again to remind them about cleanliness and about this disease like dengue, how to prevent it. So I thank God for Brother Akash, who is doing actively and he's interacting with young people and sometimes door to door, and he's very good, one of the volunteers that we have got in this slum. So here are thousands of people live out here, so still there are people need this our teaching. But thank God those who have learned about our zero method teaching, they are also teaching other people out here. So this is how the people out here they are very much aware about dengue, and that's why we are able to succeed the prevention of dengue out here. So I thank you from my heart. I especially thank God and SMM, those who have been helping us since 3 years, and we have been enjoying this work in a different slum area and different villages in camp. So this is our program that we have been doing, and thank you so much.
Welcome to Sirigo, where I work as a teacher and as an assistant headmaster in the school. This is where I also have my project for sustainable medical missions. It is my regular route whenever I'm going for my project. And so you are welcome as we tour a few areas in the community.
Somewhere towards the end of 2017, Mr. Thomas came with a proposal which was involving sanitation and the need to embark on a campaign in Sirigu community. So as a health delivering facility, we saw the need to partner with him and support him in that regard. So he invited us for a program to come and demonstrate hand washing, which we did honor. We demonstrated effective way of washing hands in order to reduce bacteria and then germs to prevent contracting diseases. We realized that the program was very helpful because after the demonstrations and the campaign going on, we realized that the program had a lot of impact on the community. Before the campaign in 2017, our data showed that a condition, for instance, worm infestation, we had about 587 worm infestations at the end of 2017. After the campaign, by 2018, worm infestation cases has reduced to 342. And at the end of 2019 year review, it has reduced to 293. 2020 is still ongoing, but we have realized that still the statistics will further come down. So it shows that the program had a lot of impact. Despite this program, there are still a lot of challenges within the community and the facility too as well. Within the community, the program is on sanitation, yet we have a lot of, almost every household in Sirigu do not factor in a toilet facility when building. And also the community too does not have public toilets to serve the needs of the people. So if we are embarking on sanitation program and the community has no toilet, we are likely to go back to square one.
I went to the health center to find out from them how they were faring and the commonest diseases that they were confronted with. And they gave me a list of them, the top 10 diseases that afflicted the people within the community and that kept occurring after treatment. And so when we looked through, we realized that malaria was one, diarrhea cases was one, intestinal worm was one, there was elephantiasis and a few others. So looking at all those things, we realized that some of them fell into the neglected tropical diseases. So we had to zero down to intestinal worms, which is ascariasis, which is one of the prevalent issues in the community there. I happen to have worked in the regional education office where during the Ebola season time, we went through the region educating school children about hand washing and environmental and personal hygiene and etc. And so I had some of this material that were done by World Health Organization on hand washing, and there was another animated one on diarrheal cases. So I quickly went to get all this information and put it together to form my own material. So we're able to do all these things last year. We provided latrines, came out with a music video, we showed them how to wash their hands, personal hygiene. The women were taught how to keep their houses, their bowls, their utensils, their kitchens, and taking good care of their children. All these were taught them last year by the grace of God. We couldn't do much this year because of the COVID-19, but Sustainable Medical Mission was able to help us. They were able to provide us with some money for us to buy food to support the people. Because when the issue came up, the whole place was locked down. People couldn't go out. They couldn't go out to market. They couldn't go out to trade. They couldn't go out to do anything. All of us, there was a complete lockdown. And so there was already an existing problem. The place was devastated with poverty. No food. I mean, there was virtually nothing. And now there was a lockdown. What were the people going to eat in spite of the lockdown? Life was becoming very, very, very terrible, especially for some category of people we call the vulnerable, the old ladies, the widows, the orphans, and people in the community who were in real abject poverty. And so it was a very good news and a welcoming news when Pastor Sam told us that David had raised some funds and they were going to give to us to help buy food to meet the needs of the people, which for me was very good because Jesus, of course, went to preach. At a point when they were hungry, he provided them with food. We remember the fish and the bread story on 2 occasions. He healed their sick. He didn't just preach the gospel. And for us here at this part of the country, really was so much, it had so much impact and meaning to us because that was the full gospel. We had preached to them, we had given them health education, and now we were meeting their physical needs, providing them with food. And we want to say Sustainable Medical Mission and all the donors and all the partners who supported to provide food for them, thank you very much, and the Lord continue to bless you. So when the food item came, it came in 2 badges. We first went and realized that we were able to meet just a few, but the case was so serious. And so we're still excited when the second tranche of the money came for us to buy food, which we have the videos and the pictures. We went to meet the chief actually, who selected people who were more vulnerable and more hungry. So these people were, a cross-section of them were brought in. And I think that when we took the statistics at the time, the food was able to meet households and people who were in need. We counted almost 400 to 500 people.
The Lord bless all those who have given and supported us. I do want to take the opportunity also to thank all who really got behind us during the very difficult time that the world found itself, but more so for those of us who live in poorer communities when the COVID-19 season hit. Many people in our communities were literally going hungry for days. And thank God that He moved the hearts of our friends in the US and they came to our aid, that we were able to provide food in a way that we never imagined. Food to communities and individuals in their homes. And people are eternally thankful that this provision came, even though the needs continue to stare at us in some shapes and some forms. There are still people who are hungry. But what is happening is, in order not to be so dependent, we have taken the initiative to start what we call farming together. Farming together initiatives where community members come together to farm and then they grow the produce, they share the food, they sell some, yet we also set aside a percentage of what has come of our produce, sell and keep the money for this work that we are doing, and also keep the very good seed for the next season of planting. So we hope that this becomes sustainable and we are able to sustain our own work going forward.
What you've witnessed today in these videos is the evidence that there is no single solution as a way forward. With neglected disease or even world pandemics, these are complex problems that exist in complex communities, and you must offer a way to organize complex solutions that can be nimbly handled and continued with the efforts of those who really have the best ability to solve the problems. Those who, yes, need the medications, but need to understand and use those solutions with their own resources. This is sustainable medical missions. It's sustainable because it is a process of using best practice faith and medical information in a way that can be handed off to those who need to use it for the rest of their lives, for decade after decade after decade. It is medical because it is a collection of medical best practices that have been organized with great rigor and method, but simply communicated in ways that, again, can be carried out and then shared with others through the languages and the cultures and the behaviors of those in the field. And it is missions because without the great physician guiding us, giving us strength and encouraging us, we will otherwise be confused that life is dark and hopeless, when instead it is bright, it is possible, and it is already occurring. God bless you.